Hi, it's Dr. Newman, board certified plastic surgeon in New York. I want to talk a little bit about what makes an area appropriate for liposuction. In almost all areas in your body underneath your skin where you have fat, liposuction can potentially remove that fat. Not in all areas, but most areas. But what makes one area better for liposuction than another area, and it really has more to do with the quality of the skin in that area than it does the amount of fat in that area. Sure, liposuction will remove fat, but in a sense, if you think about that fat being in a sack, then when you remove fat, you're emptying the sack somewhat. You empty the sack somewhat, you make the sack looser. And when you do liposuction, you depend upon the skin over that fat to kind of contract down now over a smaller belly or a smaller hip. If the skin doesn't have a good contractile property, then yes, you'll be smaller because we remove the fat by liposuction, but now that area will be loose. So if that area ends up being looser, that doesn't necessarily make it more attractive. So we have to kind of balance how much fat there is in an area versus the quality of skin. This is the reason why things like Renuvion, we've had smart liposuction, ultrasonic liposuction, lots of different technologies have come about to help tighten skin at the time that we do liposuction. Renuvion is probably the best thing now on the market to help tighten skin. But unless you end up with skin that's going to contract over an area where you do liposuction, you're going to end up with a smaller but looser area. So quality of skin and the amount of fat, both are important when we decide who and where is appropriate for liposuction.